Hello, good evening. It's Dr. Chidi Ufundu and our popular, very important open clinic in YouTube. Today, we're going to look at the possibility of achieving pregnancy in a blocked tube situations. So, how can you overcome the challenge or, excuse me, blocked tubes? Can a woman that have blocked tubes become pregnant? Is it possible? What are you going to do? So my name is Dr. Tride Ufundu, and it's a big privilege to be in your midst this evening. So please, can you introduce yourself? Tell us who you are. Tell us where you're located. Then we're going to spend about 30 minutes to understand what you need to know about blocked tubes and possibility of pregnancy. There are so many things you need to know differently. There are so many fear factors out there. There are so many fallacies. There are so many claims. There are so many people taking so many drugs, which is actually making it worse. But I'm going to tell you right away, yes, it's possible to become pregnant with blocked tubes. Blocked tube is not final. There are so many factors we have to consider when it comes to pregnancy with blocked tubes. So many factors. I'm actually starting. So when you come in, join, but please introduce yourself so we can know who you are. Admin is going to join shortly. Now, when you have blocked tubes, there are three factors we have to look out for. What is the severity of the blocked tube? Where is the position of the blocked tubes? What is your fertility index? Now, there are principally three areas you can have blocked tubes. So the blockage can be on this end of the tube. This is the end that connects to the womb. This end is called the proximal tube. Blocked tube can happen on this end, the end that is connected to the ovaries. This end is called the distal side of the tube. Now, the whole length of the tube can be blocked. Blockage can be mild, moderate, and severe blockage. Factors that can lead to blocked tubes. The most important factor that will lead to blocked tube is actually untreated sexually transmitted infections. So if you have gonorrhea or chlamydia and we don't treat it properly, they love the tubes. So they can form a complex we call pelvic inflammatory disease. They travel to your tubes, they destroy your tubes. Now, if you've had previous medical surgery, polypectomy, myomectomy, cesarean section, in course of doing that, they can damage your tubes. Your tubes are very, very sensitive. Now, some women can also have endometriosis, and some women can have very big fibroid that can occlude the tubes. These are the major factors that can play a role in blocking your tube. So the management of your tube regarding the tubal blockage, which actually contributes about 1/3 of all the infertility problems. So it's a very big factor. So the management of your blocked tubes regarding you becoming pregnant is actually dependent on the type of blocked tubes you have, on the area of the tube you got blocked, and the severity. Now, for a woman that has mild blockage, you don't even need treatment. What you need is to go for your fertility assessment, your fertility investigations. One of the fertility investigations we will normally require you to do is called HSG, hysterosalpingogram. If you have a mild blocked tube and you go for hysterosalpingogram will open your tubes and you will become pregnant naturally. Now, some women might have moderately blocked tube, which might require a medical procedure we call hydrotubation, and your tubes can open and you can become pregnant. However, if your tubes are severely blocked, especially if the entire length of the tube is blocked, then you will require micro-invasive surgery. It's not all centers that have this. It's only few centers that will have micro-invasive surgeons. So what do I mean by micro-invasive surgeons? Your tubes are very sensitive. Most times, in cost of operating on the tube to correct it, you cause further damage. Because when you're operating on the tubes, when the tubes are healing, they will heal with scar tissues and we will damage your tubes further. So we need a professional, micro-invasive, minimally invasive surgeon who can carefully go to your tube, correct the problem, remove the blockage, cut off any part of the tube that might be giving you a problem, and you will have a chance to becoming pregnant. So pregnancy is important. Pregnancy is still possible despite the fact you have tubal blockage. Now, the key player regarding pregnancy is actually the number of tubes that are blocked. So if the left tube is blocked, but the right tube is open, will pregnancy be possible? 100%. Why? Because you need one healthy tube to become pregnant. So a woman that is blessed and maybe PID damaged one of your tubes, but the other tube is open. Can you become pregnant naturally? Yes, my sister. Can you have twins? Yes, my sister. What about triplets? Yes, my sister. You can. So long as you have one open tube, one healthy tube, you can become pregnant. Now, I will tell you what will not help you if you have tubal blockage. There are so many nyama drugs. There are so many nyama herbs. There are so many things that people are telling you, oh, when you take it, it's going to dissolve the blood tube. It is not true. You are flushing your money down the drain. There is no drug up to today. We've proven evidence-based ability to block your tubes. We do not have that drugs. So many people can claim, so many little studies can claim. There are so many factors that can play a role in your tubal health. So do not be deceived. I will rather you ask than you go and waste the money you don't have doing things that will not work. So we can no longer plead ignorance. There is no herb. There is no drug that will open your tube. You need help. Pray that your tubes are not both blocked. If both of them are blocked, that's where we begin to have some further challenges. But can you become pregnant when the two tubes are blocked? 100%. What do you need? IVF. Why do you need IVF? Because if this tube is blocked, the eggs cannot come in. If this side is blocked, the eggs cannot come in. If the eggs cannot come in and the sperm cannot come in, pregnancy will not happen. Pregnancy happens in somewhere around here called the ampulla. So if the eggs cannot come in and the sperm cannot come in, fertilization that is supposed to happen in the tube will not happen. You will not become pregnant. Now, if this tube is damaged, but the ovaries are still intact, can you still become pregnant? Yes. What will happen when you release the egg from this side? Instead of going through this side, it's going to forget this side because it's closed. It will float and go to this side and get you pregnant. So your tubes are floating, all your reproductive organs are not fixed. So a woman can release her egg from the right ovary and enter through the left tube, and you can become pregnant. Now, some people might have the option of going for IUI, intrauterine insemination, which is also an option, especially for men that might have male factor infertility. But the criteria for IUI is to make sure you have at least one open tube. So pregnancy is still possible despite your blocked tubes. But don't delay in doing the right things and making it worse. Don't take any herbs. Don't take any drugs. Don't keep going to places they will tell you they are flushing your tubes. Meanwhile, your tubes are severely blocked. What I will personally recommend is to have a very truthful, God-fearing, caring, compassionate doctor that will tell you the truth. If you follow me, I tell you the truth. I can never deceive you. I can never tell you lies. I'm not here to be famous. I'm just here to help you to become pregnant. So it's important you select the right kind of doctor. There are so many women that have been wasting their time flushing tubes that are completely blocked. That's a waste of time. go and look for money for IUI, go and look for money for IVF, or seek alternatives. Go and look for money for surrogacy, or go and adopt. There is nobody that cannot be a mother. But how you become a mother will differ. Everybody is not going to become a mother the right way, the one way. There is no right or wrong way. So understand that despite your blocked tubes, you can still become pregnant with help. Very important. Now, the problem regarding continuing to become pregnant with partially blocked tube, this is dicey. There are some women that will have very mild blockage. But the problem is, when the fertilization happens, they will refuse to go and implant in the womb. The pregnancy will start developing in the tube, a condition we call ectopic pregnancy. Very deadly emergency condition that can kill you before you blink. Your tube is not structured to sustain pregnancy. So any woman, unfortunately, that the pregnancy refuses to come down in the womb and continues to develop in the tube, unfortunately, most times we are going to cut off that tube to save your life. Thankfully, if this side is good, you can still become pregnant. Very important. I will personally will not want you to become pregnant than you become pregnant and it's a ectopic pregnancy. Because at the end of the day, you're going to lose your tube. But there is nothing medically that can stop you from becoming a mother. If you're determined, when plan B fails, switch to plan C. When plan C fails, switch to plan Z. There is always a way you can become a mother. There is always a way you can become a father. So this is very important to me. If you notice, I take my time to teach this. Very, very poor turnout today, but this is one of the most important videos you can use to gain knowledge. So if you understand the nature of your tubes, if you understand the severity, if you understand the positioning, if you understand your fertility index, there are a couple of the other factors that can combine to further make your infertility worse. Like if you're 35, by default, you're already struggling with a low ovarian reserve. So you do not have the liberty of wasting all your time flushing your tube when you're in your 50s. It simply doesn't make sense. Okay? So guys, I'm going to open the clinic now. And I want you to quickly ask your questions. Very quickly, simple, straightforward questions. I provide you feedbacks. Immediately after this clinic, I'm going to go to our Facebook, our page, and I will repeat this topic because we have a lot of people there. There are so many people that need this message. But right now, the clinic is open. Please feel free to ask your questions. COO of our organization is also in the clinic. So focus on the COO. If you need any help, she's going to help you. But for the purpose of tonight's clinic, please start asking your questions. Feel free to ask your questions. If today is the first day attending my open clinic, thank you so much. I love you. I want to help. Make sure you subscribe. When you're done subscribing, share this channel. When you're done sharing, comment, like, make it go viral. There are so many women that need help, and we are here to help. But right now, the clinic is open. Please start asking your questions. Now, forgive me, but I'm going to enjoy my cucumber water. My wife made this cucumber water for me. So if you envy me, go and ask your partner to make one for you, or you can make one for yourself. This is very healthy, my cucumber water. Okay, let's talk. How long is an HSG result valid? 6 months. Anytime you are going for any fertility assessment, make sure they are as current as 6 months. 6 months is a long time. Enough time for so many changes to happen to the body of a man and a woman. So a man that got a woman pregnant in January might start having problems by December. He would have developed problems. He would have developed low sperm count. In the same vein, a woman that the tube is opened in January might discover that by December, her tubes are blocked. So 6 months, make sure you are current. I know it's expensive, my people, but if you must spend your money in the direction of things that will give you permanent joy. Your babies are going to give you permanent joy. So don't compromise standards. So yes, 6 months, okay? All right. Is there any symptom that indicates tubal blockage? Now, this is a very, very lovely question from Kenneth, our COO. Now, some women will not have any signs. It will just be a quiescent dorsal development. The only way we will know is when we send them to do HSG. Lo and behold, we will notice that the tubes are blocked. Now, some other women might develop pain, discomfort here and there. But classically, majority of women that will have tubal blockage will not have any symptoms. They won't even have pain. The only way for us to discover is when we send you for HSG, then the fluid will not pass through. Then they will come back and say, oh, the left tube is blocked or the right tube is blocked. That's the only right way to know if your tubes are blocked. So majority of women will not show any symptoms. That's the deadly aspect of tubal blockage. And the problem is this. The factors that lead to tubal blockage might be with you for 20 years and you won't even know. Some women can have gonorrhea, they can have chlamydia for 20 years, they will not. You would have picked chlamydia at your first sexual encounter when you're 15, you picked chlamydia or gonorrhea. You didn't treat it because you were afraid or you didn't have the knowledge. Now, somewhere around your mid-25 or early 30s, your Prince Charming came in and you guys are planning to have 5 kids. 1 year into your marriage, no baby. 2 years into your marriage, no baby. You begin to go to churches, you begin to seek solutions outside the doctor's domain. Before you blink, it's already 5 years. Now, by the time you come to the doctor, you might start with the doctor in your backyard. You begin to go to general practitioner before you get to gynecologist, before you get to a fertility specialist, before a real doctor will tell you to go for HSG. By then, we discover that your tubes are blocked because without that HSG, we will know. So you need to be careful. Okay? All right. Someone that had fibroid surgery and 3 months after that, the gynecologist noticed one of her tubes is blocked. How long can she try before going for infertility? Now, if you follow us, we don't try. We are not people that try. Trial is a passive word. We believe. Now, there is no mathematics in fertility. Like in your case, someone that had fibroid surgery, right? That's a good thing. So if your fibroid is significantly impactful on your fertility, we'll recommend you remove them. So you've done the right thing by removing your fibroid, okay? Now you say 3 months after. Now I'm worried about this chronological history because this is not the right way to practice medicine. Before you go for your myomectomy, a good doctor will run all the important fertility panel. Do you know why? Legally, if you're going for any surgery, you have to have a baseline. You will have to have a baseline blood work. We have to have a baseline investigation. So what do I mean by baseline investigation? We are entering your body. We have to have ultrasound to tell us exactly the position of that fibroid. We might even go to CT scan or MRI. Then definitely we need we need to have an HSG baseline. Why? Because if you're signing a surgical consent form, you are signing a surgical consent form from the perspective that your tubes are open, from the perspective that you don't have any pathology. So if anybody is going into your body, after going into your body, if we investigate and we discover that a new development happened, we can check the chronological order to see when it developed. So how will you know that it's not during the fibroid surgery that they damage your tubes? Do you see my logic? So it doesn't make sense for someone to operate on you for myomectomy, but prior to myomectomy, during your blood work, they didn't run HSG. That's very careless. So it doesn't make sense to me. Okay? Now the gynecologist noticed that one of the tubes is blocked. Now the question is, what type of blockage? What's the severity? Where's the location of the blockage? How old are you? Okay, you're 36. Now at 36, you cannot play, I'm coming, I'm going. You have to be decisive. You have to know what you're doing. Now, what I will tell you is this. Make sure you have a reliable, experienced fertility doctor. You've already taken a bold step of going for myomectomy. That myomectomy, if they didn't do the right things before the myomectomy, it's never late to start doing the right things, okay? Now, if your tubes are blocked and you've gone for myomectomy, now, the determining factor is the extent of the tubal blockage. And if the two sides are blocked, if the two sides are fully blocked, then you don't need to waste time. You go and get money and start doing IVF. Because if you wait till today to infinity, a fully blocked tube is blocked. This is not something you tell God, I'm coming, I wake up and miracle will happen. Miracle can happen, but miracle will happen to people that go through the right directions. If God is telling you to go and prepare for IVF, but you're standing your ground and you want God to come down from heaven and do something you can do for yourself, then miracle will not happen. I'm just telling you the truth. You have to understand that at 36, you are 1 year above advancing maternal age cutoff point. So you need to be decisive. Okay? Keep asking your questions. I have 11 people in the clinic. This is very, very important topic to me. So please don't be shy. Ask all your questions now. No. If you want to code your question, oh, there was this friend that was going to Lagos and I saw her in the bus and she had this and she had that. If you want to code your own history, that's okay. But ask your questions. Okay? All right. How can fibroid cause tubal blockage? I'm going to award you honorary doctor of SGHS medical practice. Okay, beautiful question. Let me teach you. You see, there are different places you can have fibroid. So you can have fibroid inside this beautiful cavity. 2 types, intramural and submucosal fibroid. Or you can have subserosal fibroid, the type of fibroid that is not on the inside, but it hugs the body of the womb. Now, this is the type that might likely cause problem. Now, if you have subserosal fibroid bigger than 6 cm or even tending to 10 or 12 cm, they can be so big to the extent they can occlude this side of the tube, or they can even occlude the entire length of the tube. So if you have significantly big subserosal fibroid, they can, in course of growing, have what we call mass effect. So when it's expanding and growing, it will be growing upwards and it will occlude your tube by default. This is how fibroid can lead to tubal blockage. Now, if you have this type of scare, what are we going to do? Definitely remove the fibroid, because some women might end up losing their womb if they don't deal with their fibroids on time. Kenneth, I love that question. And starting from today, you're going to be Dr. Kenneth. I'm going to award you free doctor degree. You're doing amazing. Every time you show up, you do an amazing job. Okay, Tosi, you're just arriving, okay? Evening, doc. Is it possible for a woman to have blocked tubes at birth? This is another lady that might likely go to medical school. Now, the fact is, yes, it's rare, but count yourself blessed. If in course of going for fertility treatment, we discover that your whole reproductive system is intact. Unfortunately, there are some women that are from birth, they don't have vagina. There are some women that might have blind vagina. So the vagina opening might be there, but if you begin to go up, you won't have you won't have the cervix, you won't have the womb, you won't have the tubes. It's called a syndrome. I'm not going to bother you with the medical terminology, but unfortunately, some people are born with congenital problems. Some people might have missing cervix, missing womb, missing tubes, missing ovaries. It's rare, but it can happen. But most of the problems that will lead to tubal blockage are acquired. Things that will happen to you once you're already born. I love that question, Tosi. There's another intelligent lady. Very regular. Thank you so much. Are there any food one should cut off after myomectomy? Now, this is an area that some people use scare techniques to put fear in you guys. What you need is to eat the real food, though. The 5 classes of food. Eat it like a normal person. Don't start eating your yam or swallow or rice and you eat it to stupor. There is no food you should avoid. Eat all food items, but in a very sensible way. Okay? Now, in course of that acute surgery, of course, you have to start from very light food. You don't want to go and swallow fufu 5 days after your myomectomy. You're going to definitely cause yourself a lot of problems. So you gradually introduce light, semi-solid, then over time, you're going to eat properly. So there is no specific food you should avoid and all that. We don't run like that. You need all your food items, but you need to eat them like a very, very sensible person. Okay, guys, keep asking me questions. We still have about 6 minutes. We still have time. Keep asking all your questions. Now, let me make this categorical statement. There is no infertility problem you have today that you cannot overcome to be a mother. The only reason why you might not be a mother is by choice. There are so many ways you can still overcome your infertility, no matter what the problem is, and become a mother. Now, understand, not all women will become mothers through pregnancy. There are some women that will not practically become pregnant themselves, but they will still be mothers, original mothers. undiluted mothers, genetic mothers, DNA mothers. So you will understand. So stop standing in one lane. If it's not this, then you're not going anywhere. There are some people that have spent 10 years, 20 years. The other day, someone was even telling me 28 years. My sister, what are you waiting for? 28. It doesn't make sense. Once you get to 35, you better wake up and smell the coffee. 35 goes so fast. You will blink, you will see yourself on the 40th floor. 40. Once you get to 40, you are going into retirement. You blink, you're in retirement. So acquire knowledge. This is why we focus so much on knowledge. We spend a lot of time bringing out good topics that will help us, because we cannot allow the ignorance of infertility to steal the biggest joy in our life. I know the biggest thing that will make you happy in life is to be who? To be a mother. You cannot allow your micro environment and your society and the people around you to deceive you and distract you, because they will make you feel like you're not a woman if you don't go through the route they went to. Not everybody is going to go through the same route because you're not born the same day. Be careful, be wise. Always go to a doctor that will tell you the truth. And if you notice in our group, we tell you the truth. Some truths are very bitter. But just like Ofo Nubo, bitter leaf. When you eat it initially, it will be bitter. But when you begin to bask in the joy of it, you will enjoy it. Ofo Nubo is my favorite Ofe. But it's called bitter leaf. There is good in some bitter things. So gain your knowledge. Okay? All right. Can surgery open blocked tubes? Yes, can it? But the problem is this. If you don't have a facility that has micro-invasive surgeons, very specially trained doctors that can use precision to enter your tubes and remove only the blockage and remove only the scar tissue and remove only the damage. The problem is your tubes are so sensitive that we cannot take chances. So the answer is yes. Unfortunately, you can have these people in few locations in developed countries. I think we are getting there in Nigeria. So yes, if we have the expertise, you can go, but don't go to place they will butcher you. Some people will even wake up in regards to correcting their tubes, and the two tubes are gone. That's a fact. There are some people that go to some places, they will open you up and collect all your reproductive organs and suture you back. How will you know? Whatever they tell you, you believe, because you don't know knowledge. But you have to equip yourself with the right knowledge. So the answer is yes. But it has to be expertise from micro-invasive surgeons. I love those questions. Now, Busola Saliu, probably you made a mistake. If one tube is blocked, how long should someone try? Remember, my sister, we don't try. And it's not mathematics. Of course, if one tube is blocked, if you're looking at percentages, if you used to be at 100%, with one tube you're now at 50%. So there is no time to wait. You begin immediately. Anytime they tell you your tubes are blocked, you run, don't walk, because you have been compromised by 50%. So anytime they tell you that your tube are blocked, the other tube is the saving grace. Once that other tube is open, you can still become pregnant naturally. But be careful. Seek help immediately. There is no room for waiting. Once you want to be a mother, no room for waiting. Just do everything that will make you a mother immediately. Correct. There are so many ways now. Come on. There are so many ways you can be a mother. It is not only one way. You can go to the vagina. We can forget the vagina. We can give you fertility treatment. You can go for surrogacy. You can go for donor egg. You can go for donor sperm. You can adopt. They are all mothers. You can foster. You're a mother. A mother is a mother. A baby is a baby. There is no competition. Do you know that if we extract majority of our members that are having infertility in Nigeria and we bring them to this part of the world, by today, you will be shouting in your daughter's and your son's house that these kids are not allowing you to sleep. You'll be telling them, you notice sometimes I'll be telling Dumeje, easy, easy. Like I have to practically give Dumeje bribe to vacate my consulting room. Because the guy came back from school, he was all over my computer. That's the joy of knowing your options. So don't stay in one lane and thinking, oh, my own is ended because I cannot become pregnant by myself. Oh, what can I do? Oh, what can I not do? It is not in your place to do something. There are people that can help you. Stop staying in one place and start looking for solutions where you can't find solutions. Anybody that didn't go to medical school cannot help you, man. Look, I'm telling you the truth. Stop wasting the time you don't have, especially in October. We cannot afford to waste time further in this group. No, we are done. Okay? Admin, I don't know who this person is. It looks like someone it's trying to badge into our group. I don't know if you saw this, whatever, free girl, whatever, So guys, my time is actually up. Thank you for coming. Please join me in our Facebook page. We're going to repeat exactly this topic. Remember to register for the event coming up on the 30th. Gender selection. If your life is dependent on having a baby boy, baby girl, and that's the way to bring peace in your home, go and register for that event. Okay? Register for that event. It's open now. And if you live in Nigeria, you can get a consulting package. If you don't live in Nigeria, it's okay. Go back to your gynecologist, go back to your primary care provider, go back to your fertility specialist. They will attend to you. Okay? Thank you for coming. Join me in our Facebook, and we're going to continue there. Thank you for coming. God bless you, and bye-bye.